When I looked at these slides earlier on, I thought, that's, forgive me, but actually if that is the definition of concussion, it's quite vague, isn't it? Because only the first sentence, which is a definition of concussion, which is mild traumatic brain injury. Yes. The others are how it might have happened rather than what it actually is.
Yes, I mean, a concussion is a functional injury, so imaging will be normal. And that tends to be very often when you go into A&E, they assess you, imaging is normal, so CT or MRI is normal, so it's, well, you haven't got anything more severe, it's just a concussion. Yes. But actually, a concussion or a mild traumatic brain injury can be quite debilitating.
Yeah, I suspect that many people will be surprised that whiplash could also lead to concussion. Because we do tend to think of it as what happens when you get punched or when you get a hard tackle or a heavy fall to the ground, usually a blow to the head.
Yes, yeah, absolutely. It's a bit of a misconception that you need a blow to the head to have a concussion. And quite a lot of concussions will occur through sort of even a fairly low speed road traffic collision where somebody is shunted from the rear. You get that whiplash injury, but the forces are enough to cause a concussion. So we know that a concussion happens at around about 70 G of force, a whiplash...
70?
70, yes, yeah. 70 G of force. A whiplash injury will be at 4.5. So anybody who's got a concussion is going to have a whiplash, but when you're seeing these patients that are presenting with a whiplash, then you need to consider the mechanism of injury. Was there enough force there that actually some of these symptoms could be down to...
Of course, it's hard to know, isn't it? I mean, do you have any, I don't know, ballpark figures for how many Gs go through the neck or the head, you know, in a road traffic collision? Obviously, it depends on the speed. But...
There is so many variables, but it is quite common to get a concussion from a rear end shunt in a road traffic accident, right, because you've got that sort of acceleration, deceleration, and the force being transmitted to the head.
Yeah, and what's the likelihood of those symptoms persisting beyond what we normally expect, a day or so?
So concussion symptoms, you know, if you look at the literature, it's quite interesting. If you look at the literature, about 80% of concussion symptoms will have resolved between 7 and 10 days. Brain recovery actually takes a little bit longer than that. So the brain recovery is, you know, anything up to 21 days. But then the literature also says between 10 and 30%, which if you do the maths doesn't quite add up with the 80%, will go on to be persistent concussion symptoms. So symptoms that are still present at 28 days or longer. And I see people who've had concussions for months, if not years.
Right, and I suspect at some point you're going to tell us how you work out that it's a concussion and not something else that they're suffering from, as well as you know, what you're going to do about it afterwards.
Yes, absolutely. So we go through the sort of the 5 theories of why it can be a continuing concussion. Right. And we also look at the neck as well, because we know, you know, that if it's less force for whiplash than it is for concussion, the concussion is likely to have a whiplash element to it.